You give a stimulant to a child that's already hyperactive and they calm down. Have you ever wondered why that is? Well, I'm going to explain it to you right now. Let's talk about ADHD. It's not a child thing. Adults have it too, where they're having trouble focusing, concentrating, and they have to fidget all the time. They have to keep moving. And when they move, they can concentrate better. So attention deficit hyperactivity disorder. The treatment typically is you give them a drug that's a stimulant, and I'm not going to mention any of the brand names, but you guys know what they are. Some of those drugs are actually abused by other people because they help you really hyper-focus on things. See, the human body constantly communicates with the brain. There's a nerve that goes from your brain to every cell, every tissue, every organ in your body. There's nerves that go to every joint in your body as well. So right now, you don't have to look at your knee to tell me if your knee is bent or straight, because the knee is constantly communicating with your brain, every joint. Now, when you're not moving, there's, for example, 1 signal per second going to the brain from, let's say, your right foot. But when you move that foot, it becomes hundreds of signals per second. Just a burst of input, and the center in the brain that controls that foot really lights up. If you do something like a functional MRI study, you'll see these centers of the brain light up when the body moves. So we know that the brain receives information every time there's movement. So these children who are hyperactive, they have to keep moving to stimulate the brain enough to be steady, because most likely that signal that was 1 per second is not getting up there. And the brain is constantly going, where's my body? Where's my body? Where are my feet? Where are my legs? Now, it's not a conscious thing. It's physiologic. It's autonomic. It happens naturally. Your brain is constantly looking for your body. And that's why you can't concentrate unless you're moving your arms and legs. You're tapping, you're fidgeting, you're walking, jumping, whatever. Now, someone who's not receiving enough information in the brain, you have them jump rope and they'll be able to pay attention in a classroom. You have them pace back and forth, they can pay attention because now they're stimulating their brain at a normal level. See, these people aren't hyperactive, they're actually hypoactive. The activity is lower than what it should be, and they have to move their joints to increase stimulation to the brain. That's why when they take a drug that is a stimulant, that's a drug that normally would make a normal person hyperactive, it calms them down. Because instead of vibrating at this level, they're vibrating at this level when they sit still. So they have to jump, run, play, move to bring that activity up to normal. You and I are already here. An ADHD kid is down here. It's like a top that you spin. The faster it spins, the more steady it is. When it slows down, it starts to wobble. They're wobbling because they're not spinning fast enough. I hope that analogy makes sense. So they take a stimulant. Even coffee would do it. Coffee is a stimulant. It can bring that vibration back up, and now they can feel a little more steady. And so how does chiropractic help that? Chiropractic will find areas of restricted flow of nerve information to the brain. Those impulses are being blocked by something. A lot of times it's because the normal curve of the neck is missing. Sometimes it's because the first bone in the neck is rotated out of alignment and it's actually interfering with brainstem function. That's a fact. We know C1, C2 misalignments will interfere with the brain, and a loss of normal cervical curve will reduce blood flow to the brain. Well, all of those things can lead to this. And so these people have to move to be able to stimulate their brain properly so they can be calm. And so the solution is exercise more, find out where the block is, remove the block. And again, just like when we talked about vertigo, I'm not saying every case of ADHD is a case that requires an adjustment, but I can tell you adjustments do a great job of stimulating the nervous system just like a stimulant would. And so at the very least, it's a great way of supplementing what you're already doing. I hope that's helpful to you, and we'll talk again soon. If the video is good, share it, subscribe to us, like the video, comment so I know what you're thinking, ask questions, we'll try to answer your questions. Take care.